Today, it is a great honor and privilege.
Be in good health means to me to have balance, to be able to be present in every situation.
Black people have the highest rates of HIV in the country. We only make up 5% of the population, 25% of all HIV cases.
By systemic barriers.
I like that question. So you clearly you've seen the TAIBU logo. You know what it looks like.
Yeah.
So you know the two hands that are right next to each
Yes.
other. That's how I knew that this was my space. So again, my grandmother used to always laugh.
C'est des questions que toi aussi tu peux très bien répondre.
Mais c'est moi qui demande les questions aujourd'hui.
Merci beaucoup à Liben. Je pense que la séparation de famille et des familiarités.
First, thank you, Libyans. I'm happy to be here. It's always good to have conversations with you.
The Be in Good Health show in honor of Denise Brooks.
And that the people with the highest risk were going to be Black and Indigenous people.
This is a platform dedicated to discussing and advocating for the physical, mental, and social well-being of the Black communities. Greetings. Welcome to our first ever podcast produced by TAIBU Community Health Center, the Be in Good Health show in honor of Denise Brooks. This is a platform dedicated to discussing and advocating for the physical, mental, and social well-being of the Black communities. Our hope through this podcast is to provide or to be a source of information for conversations and insights into maintaining and improving the health of Black communities. We strive to educate and empower our listeners by inviting experts, healthcare professionals, community leaders, and elders, and to share their knowledge and expertise. Our goal is to amplify these conversations and to discuss the unique challenges faced by Black communities in accessing quality healthcare and providing resources and support to help individuals take charge of their own health and well-being. I'm your host, Liben Mikael, the CEO of TAIBU Community Health Center. Today, it is a great honor and privilege to have with me a very important person for the work that we do here at TAIBU, but also for the work that has happened and continue to happen in addressing the health inequities for Black communities in the Greater Toronto Area and in Canada. We have Dr. Christopher Morgan, who's the founder of the Black Health Alliance and the founding member of TAIBU Community Health Center, and it is a great privilege to have you here with me. I'm a little bit nervous, but I think through our conversation, I'll be able to relax. The nervousness is just because of the great respect that we at TAIBU have for you and for the work that you've done. And so in our episode today, we will be focusing on anti-Black racism as it is the foundational concept for the work that we do here at TAIBU, but also for the work that needs to happen to improve the health and well-being of Black communities in the Greater Toronto Area. So welcome, Dr. Christopher Morgan. I usually call you Chris, so I'll continue to do that with your kind permission. And so maybe before we go into some of the big discussion points, I'm just wanted to see, for you to share with us and with the audiences a little bit about yourself, your background, your professional training, and how you became passionate about the issue of anti-Black racism and the health of Black Canadians.
Well, first, thank you, Libyan. I'm happy to be here. It's always good to have conversations with you. Here we are in TAIBU, the new TAIBU studio, so to speak.
Yes.
So this initiative is a great one. I think it's very important for us to communicate to the audience, to the community, to health professionals and so forth about Black health, the Black health agenda, what needs to be done, some of the challenges that exist, and what are some of the possible solutions that we can do to address those challenges. So Myself, I was born in Canada, born and raised here in the T dot in Toronto and so forth, and grew up here. My mom is Jamaican background; she's Jamaican, and my father's from Grenada, so there's some Caribbean background there. Didn't grow up with my father, so I was really growing up with my mother, and it was a great experience. Here in Toronto. Toronto is a very diverse community. So I had friends from different backgrounds. Matter of fact, some of the neighborhoods that I grew up with, there are Italians and Greeks and some other people from the Black and Caribbean community and so forth. And that was really good experience, just having friends. And I think one of the nice things when you're a young person, issues around race and identity, at least then, that's going back a few years, to me, wasn't as you weren't as aware or as in tune to it. You just had friends. They were just people that you hung out with, that you played soccer with, you played hockey with, or whatever the case may be, and you went to school with. And then in my elementary years and high school years, I was in Rexdale area, which is in sort of northern Etobicoke area. And it wasn't really until high school where I would honestly say an awareness of different groups on a racial, ethnic basis came to place. I still remember in grade 9 going into the cafeteria at Martin Grove Collegiate, and you had a clear distinction where you had the athletes and the black kids were here on these group of tables. The preppy kind of kids were in this area, and over here around the corner, the kids that, maybe would smoke or do a kind of that, they were over in the back around the corner here. And there was a clear almost division, and you walk into that space and you almost had to decide, okay, well, where do I fit? I'm like, do I sit with this group of kids and so on? There was less mixing of the groups and so forth, and that was when I first became aware, this is an interesting dynamic, so to speak, and you had to find your place of comfort and so on. And then, as the years go by and into university, I went to the University of Toronto and so forth. More social related issues became more relevant to me. I was in some youth groups and so forth, and had received a couple scholarships with the John Brooks Community Foundation, and then started to do some volunteer work, leading up their youth chair committee at that time. And one of the things among other young people at that time, teachers are very critical in terms of being role models and in inspiring your young life and your decision making and making you feel hopeful about the future and so forth. And in just sitting among the other black kids that were in the youth group and so forth, we got to talking about education and school and so forth, and how many of us have had a black teacher during our elementary and high school years. And I know for myself personally, I had none in elementary and one in high school. And it was interesting. I'd never forget him, Mr. Calendar, who was a grade 9 English teacher and so forth. And he made it his effort or mission to really try to look out for the black kids that were at the school. Even whether you're in his class or not, if you're in the hallways and maybe you're carrying on and doing things that maybe you shouldn't be, maybe you should be in a class, whatever, he would come out and try to, young man, okay, where should you be? Let's get it together, and so forth. And he was always encouraging and trying to help us to think about our development and being mature students within the school and become leaders and so on and so forth. And both in high school at that time and university at that time, again, the presence of black teachers and mentors in that space was almost next to none. Yeah. And that experience was shared among the other students in our youth group. And so we said, let's do a bit of a research project, go to our respective universities and so forth. We came up with questionnaires and just talk to the other students and find out, what was the likelihood that you had a black teacher? What was the impact of that black teacher in your life? And so on and so forth. And then that kind of, the results came back. We kind of already knew, but it gave us a sense of the degree and extent of how bad the problem was in terms of not having that representation in our lives and so forth. And then, of course, at that time, in high school, you had level 4, level 5, and at my school, I had level 6 and so forth. And the levels based on, academic rigor. Yeah. And you had a lot of the black kids ended up finding themselves in the level 4. Yeah. And the level 4, really, there was no pathway to post-secondary, certain at the university level, possibly to colleges and so forth. But the options available to you were less.
Yeah.
It was a much more narrow road and path for the kids that were in that area there. And so you begin to pick up on these kind of things. I remember going to commencement and they're giving out all these awards for math or English or music or variety of different things and so forth. And you go to commencement and again, there's no, where are the black kids and where are the students and so forth. And so these things begin to wear on me, and you take notice of these things and you realize that there's some real disparities here.
Yeah. Yeah.
You know, and the first one was in education because that was a big part of my life at that part in time. And then as I myself was interested in health and pursued a career in chiropractic and so forth. And so my awareness of disparities as it related to health began to became more aware of that, more in tune about that situation. And so I would say probably in early 2000 is when I was connecting with it. I was aware there's a number of organizations within the black community here in Toronto, looking at mental health, looking at HIV and AIDS, looking at sickle cell, looking at diabetes, looking at cancer, et cetera, et cetera, et cetera. Yeah. And all these different groups were trying to address the disparities. So in other words, there is high diabetes in the black community, there's high hypertension in the black community, there's mental health and so forth. And the existing mainstream public health system wasn't addressing that. Yeah. It wasn't addressing that. So as has always been the case in the black community, we had to begin to develop and find our own solutions, find other ways to ensure that our community and our members, our family members and so forth were better informed and that we could advocate for some change and so forth. So one of the things I just thought about, okay, it's great that these organizations here, but we need to be able to pull it together. Pull it together. Yeah. Can we combine our information, our resources, leverage our connections and so forth, and be able to present more of a unified front where we can both respect and uplift the individual organizations' agendas as well as work for a common good, a common goal? Is there something consensus that we can build around, something that we can all work towards? And so that was really the idea around the founding of the Black Health Alliance. And it really stemmed from there, and the work has taken us to really make some moves and make some strides over the years.
And that was the supporting each individual organizations, but coming as a community is what led to the discussion about TAIBU, I believe. I wasn't there, but that's what I've been told, and I know. Yes. So the next step of Black Health Alliance, I think, maybe not immediately. I think there were other things that the Black Health Alliance did, but that was the inception of TAIBU. Am I right?
Yes. So it was actually quite providential and destiny in terms of how we got to the point of TAIBU. So in the first couple of years between 2000 and 2004, as an organization, the Black Health Alliance, there was a big effort on health promotion initially. And then we did a little bit of health research. And then we got into sort of the opportunities around policy and changes as it led into it. So initially we were at churches and places of worship. We were at Jambana. We were at Afrofest. We were anywhere our folks were to talk about hypertension, diabetes, sickle cell, and so forth. We created events, the Taste of the Caribbean and Africa food expos, where we talked about nutrition, culturally appropriate nutrition in our community, and tie that into diabetes and hypertension and so forth. We did some research around health, around how the black youth in Scarborough navigate the healthcare system, and where we got a little bit of funding to curate that project and so forth. And we began to realize and pull together some of the data. And at the time, 2002, there was a federal commission called the Romano Report, where they're looking at transforming Health Canada and across Canada. Okay. And I remember going online and looking at the databases and all the different organizations that were making proposals. There were hospital associations, physician associations, nurses associations, all kinds of stuff. But there wasn't any, at least not identifiable by the name, that was representing the black community. Yeah. And so that's when I said, you know what, there needs to be a presence about what's happening in the black community and so forth. So I brought that to the Black Health Alliance, and then we all agreed and sort of just pulled the information that we already had from diabetes, from hypertension, from mental health and so forth, to put together a report and make a submission to the Royal Commission on the Future of Healthcare in Canada. And then shortly after that, provincially, in the province of Ontario, there was primary healthcare reform as well. Yeah. And that was when the opportunity came to say, you know what, I had always thought about an organization, a place that was going to provide primary healthcare and social services to the Black community, with the Black community in mind, in terms of providing culturally appropriate healthcare, to addressing some of the barriers that we know that was taking place. Yeah. And so in 2004, 2005, when the province of Ontario was looking at primary healthcare reform, some of the other members of the Black Health Alliance, in terms of the Women's Health and Women's Hands and Black Cap and so forth, spoke with them and they said, yeah, this is a good idea. Why don't we put in a proposal? And so we held a meeting. We reached out to physicians, nurses in the community to really start to, let's take this opportunity, looking at policy changes and getting an institution where we can really address frontline on the ground. We were able to pull on some of the work that we had done in the previous few years to show the data that there are disparities. Whereas, for example, in HIV and AIDS, the incidence and the prevalence in HIV and AIDS was going like this in the Black community, whereas it was stabilizing in the non-Black community. So, and that's just one example. The same thing could be happening in mental health and diabetes and so forth. When you went into the hospitals in the GTA, in the dialysis department, the beds are full of Black men, in particular, and Black women. And you have to ask, what's going on here? Yes. Something is happening that, in terms of, you can almost pick whatever condition you want, and the experience, the outcomes within the Black community were far worse. Yeah. And that wasn't acceptable. And so we took the opportunity to say, let's put together a proposal to see if we can get this publicly funded. As taxpayers and as Canadians and living here and so forth, we have every right to have an organization like that funded and supported by the community. As there were already organizations that were providing other services for the mainstream. Yeah. But the mainstream wasn't working for us. Yeah. It wasn't working for us. And so that work really led to us talking about what would become TAIBU Community Health Center.
Yes. Thank you. And you know, I know you say this all the time, right? Is if you want to go fast, go alone. If you want to go far, go together. Or if we cross the river together, the alligators will not bother us. So I think that coming together of communities was very significant. So this podcast is in honor of Denise Brooks. Denise Brooks, for TAIBU, but for me has been a great mentor and a friend. But I know there was a close connection at the beginning of this movement. How did you meet Denise? How did you know her? What was the engagement? Just so that we can connect it to the podcast.
Yeah, and Denise was a wonderful woman, a wonderful person, individual. I first got to know her through her sister, actually, Vicky.
Yes.
And I was working with her family as a chiropractor and working with her and so forth. And I was sharing with Vicky some of the work with the Black Health Alliance. And so Vicky said, you got to meet Denise. I got to connect you to my sister, Denise, who was the executive director of Hamilton Urban Core Community Health Center at the time. And I said, absolutely. So she connected me to Denise. And I remember having those early conversations about the Black Health Alliance and what we want to do and so forth. And she was always supportive right from the start. She was always an encourager and very much an advocate for the community and so forth. I know she was at the I think it was the Alliance of Healthier Communities at that time, or the Association of Health Community Health Center, AOHC. And she would use, she wasn't afraid to talk about Black health and the Black agenda and supporting. And she too believed in bringing our efforts together and propping up other organizations and other individuals. So I remember in the early years when Black Health Alliance, we did a conference on mental health in the Black community. and was well received. We probably had about 200-300 people from the Black community talking about the stigma, talking about the issues that were relevant, and the lack of services, and how we get into those services late in the game until things are advanced and so forth. And I invited her to come and talk about policies, because one of the things that Denise always talked about was policies, and getting things into a policy framework as much as possible, in order to help the likelihood for it to take place. And I know it's one of the things that you've adopted as well too. And of course, as the Black Health Alliance, we wanted to address mental health in the Black community. And we had a couple hundred people come out, and we talked about the stigma. We talked about the services or the lack of services, culturally appropriate services, and so forth. And that was in the first year. So in the second year, I reached out to Denise and wanted her participation, because in my conversation with her, it became evident that one of the strong points that she always pushed was policy. And how do we go from the issues and the possible solutions into a framework, a policy that can help increase the likelihood of it taking place and manifesting and so forth. And so she was more than happy to come and support and provide that strategic mindset around, okay, how do we take these stories and these possible solutions and move it towards some policy and system changes and so forth. And you know what, that is so relevant today, because I think, broadly speaking, there's an absence of accountability of organizations and institutions and so forth. And when you have policies in place, then you have a tool that you can help keep individuals and organizations and governments to adhere to their policy. So whether that be a policy around anti-oppression or anti-Black racism or anti-racism and so forth, when something is there, then you can help to make sure that those organizations adhere to it. And if they break from it, you can call them out on that as well too. And so she was always an encourager, someone that I called upon. I remember when the Black Health Alliance, our board, we wanted to do some governance and some orientation and so forth. And I called upon her, just to pour out some of her wisdom and experience to help us work on our own strategic plan and getting our ideas together. And then, of course, she always, again, just instrumental in helping our own development and just keeping us thinking strategic about what we need to do.
Yeah, no, I mean, Denise is always strategic. She's always about policy. My first encounter with her, I don't know if you remember, was she was part of the interview panel for when I was interviewed. And I remember, and I may have said this before, but I remember asking me some very tough questions. And I was saying, I don't think this lady likes me. Like, she was very, like after every question, when people are saying, okay, thank you, and then she would say, oh, can I probe? And then she would ask another question, and I'm saying, this lady does not like me. I don't think she likes me. I don't think she likes. She was very, very hard. But then, when I came to know her, she was trying to get everything that was in me to be expressed so that I was able to demonstrate. And so, but she's very strong. She's a very strong person in terms of advocating, in terms of policy, and in terms of getting people to do work, right? So, she was the person who everybody would call and say, come energize us, we need to do this work. So it was a great privilege to have known her, and also a great privilege to continue to do the work that she does. I think, we have had several partnership with Hamilton Urban Core. One of the things I remember we did work with her was the truth hearing that she did across the province, going and talking to Black communities and getting their voice amplified about what needs to happen, whether it was mental health, substance use, poverty. These are the kind of things were very, very important for her. So coming back to, the Black Health Alliance, TAIBU, addressing the inequities of Black communities, we know, and there are several studies out there, that anti-black racism has a direct impact on the health and well-being. Like, it's not just an abstract situation. Mm-hmm. We know it has a direct, direct impact on the physical, mental, and social well-being of black communities. Research done by, or studies done by Black Health Alliance has shown that. But then, as you also mentioned earlier on, various outcomes show that there is disproportionality, inequities in black communities in every area of health and social outcomes, whether it's education, whether it's criminal justice, whether it's employment, sickle cell disease, chronic disease, cancer. Like, if you, as you said earlier on, everywhere we go, we have the worst possible outcomes that is avoidable and preventable. And so with that, and on this side, having the systems not really catering and serving black communities, it's very complex. So how can we really, is just doing the primary care service provision, the health promotion that we do here, is that the answer? Or are there different levels of engagement that we have to do? And like, somebody would say, where do we really start?
It's a good question. And addressing anti-black racism it's multi-pronged. You're
Yes.
going to have to approach it from many different levels. Certainly, TAIBU, in terms of providing on the ground frontline services in a space that's welcoming, nurturing, that's supportive of black identities and black culture. So the services are culturally relevant. So I understand, the person that you're sitting trying to address, there's a cultural understanding, there's a awareness of what goes on in the community, in our mindset around certain things and nutrition. That's important because that's going to touch someone where they are, on the ground today and so forth. And that's one big approach. But even to get here, to get where we are to TAIBU, there was challenges along the way.
Yeah.
I remember clearly when we're putting forward the proposal to the Ministry of Health here in the province of Ontario, they were questioning the budget that we put forward. Right. So before, the budget in terms of, and we had done our research, right? So we knew what was competitive in terms of a budget for a project manager, for the scale and the work that needed to be done. Yeah. And it was in line with that, but yet there was pushback and questioning and so forth around our budget. And we had to stay strong and advocate for our position and the needs that we needed to get this job done properly and done it well. I remember when we talked about the priority services, and the priority populations in particular, who we wanted to serve.
Yeah.
And people of African descent was right up there in terms of, this is the people that we want to serve because of the data that we've gathered and so forth. Yeah. And there was a pushback, well, maybe why don't you guys just serve newcomers that come into the community and so forth, and new immigrants and things of that nature and so forth. And so that there is always an effort to sort of water down or reduce resources or weaken our application, weaken our proposal. And again, you had to push back and push back and push back. And fortunately, with the support that we had from allies within the political system and so forth, I think of Marianne Chambers as comes to mind right away, that can help sort of support you on the inside.
Yes.
Right? So the anti-black racism is an ideology. It's built into the systems that we have to operate in: healthcare, education, criminal justice, housing, employment, climate change. There is no area of life, when all areas or institutions of life that we have to move in and exist, anti-black racism is built into. Yeah. It's in the DNA in those systems. Yeah. And so to overcome it, you're gonna need allies. You're gonna have to be multi-pronged. You have to be, as Denise would say, very strategic in terms of, you have to be resilient, because you're gonna get pushback. Yes. You're gonna get people that don't understand. You're gonna have people that don't know or don't believe that your issues are as relevant as they are. When these institutions and the policies are set in place, too often we're not at the table. So when they're designing a healthcare system, the very fact that we don't even collect data that's ethno-specific and race-based tells you right off the bat that there's no awareness that there could be a difference between outcomes in one community and one population to the other. As you know, this has been something that the Black Health Alliance and TAIBU and many organizations have been pushing for decades.
Yes.
Right? Yes. In other parts of the world, they're much farther ahead on that. And we're starting to see some of those changes now. But it hasn't, because that's only come, not out of the goodwill of public health agencies and so forth in Health Canada, but because members of the community had pushed for it, have advocated for it, and have made those kinds of changes. So the system itself doesn't recognize us, and it's not intended to recognize it. And part of that problem is because, there were not many of us at the table when the dinner was being prepared. We weren't there to involve that. And the same could be said in education and criminal justice and so on and so forth. So you have to address, there's going to be advocacy work continuously. Mm-hmm. You're going to need allies, both in the system, so to speak, and outside community members, working in the community, folks that are in places of government and institutions and so forth. Private sector can be a proponent. Regular individuals, research. So research that kind of data driven, so that our arguments are well supported by evidence to show that these are the disparities. These are the changes in outcomes if we do things differently. We have to put forward new models of care. Again, something like a TAIBU center, and we've seen how we have to do things differently because the way things have been done aren't working for us. Yeah. So we have to put forward new models of care, new models of delivery that can show different outcomes and so forth.
So research is going to be very important. Data collection is going to be important. Policy work is going to be important. I think advocacy is going to be important. Yeah. Just to kind of continue the conversation, you mentioned about representation and not being at the table. And one area I think where representation is missing in a lot of places where decisions are made or services are provided. So whether it's on boards of health and social services, but in terms of political representation and advocacy around the political sphere, because that's also an area where big decisions actually are made. How much work has been done, or how much work needs to be done in those areas?
That's an ongoing effort, for sure. I mean, we have, you could look at every level. What's the municipal level? Look at city council and how many members from the Black community are represented. I can definitely count it on one hand, yes. No doubt about it. Yes. At the provincial level, regardless of the political party, again, on one hand, you can count how many federal, same thing. So the representation needs to increase. And so one of the things that we have to do, and I know there's organizations that are trying to push for that, is we have to put right people forward. We have to prop up and support members of our community to seek those positions, and we have to support them along the way. And then we have to take advantage of the opportunities for the community members and community organizations to put forward ideas. So for example, the Toronto Board of Health has deputations and opportunities on a regular basis, and they have an agenda of what issues are going to be tackled at the Board of Health this month and so forth. So sometimes there might be folks that are sympathetic or that are in those organizations that can let you up. You know what, Libyans, send you an email. Next month, they're going to be talking about food insecurity. And I know it's something that's relevant in the Black community. Yeah. I think it would be important for there to be some presentation on behalf of the Black community, what's happening in terms of food insecurity at that level and so forth. So, and then we have to take those opportunities and be at those spaces where these things are being discussed and put forward. This is what's happening in our community. There's food deserts. We're not getting adequate, safe food, healthy, nutritious foods in our areas. And this is what we've seen. And these are some of the solutions that need to be thought about when you're talking about a food insecurity strategy for the city or for the community and so forth. And so we have to be continuously involved in that kind of process, because if we're not there in the decision making, then we will be forgotten. I'll give you a classic example. In COVID and the pandemic, that showed, so many things were highlighted. Problems already existed. The pandemic just turned on a spotlight or increased the volume on the existing problems. So I remember clearly when the world was racing towards getting a vaccine for the pandemic and so forth. And in the hospitals and the ICU departments, we're filling up with a lot of people, a lot of them frontline members of our community. We're filling up those places. And when the first shipments and so forth of the vaccines were coming into Toronto specifically, we knew where the higher cases of COVID were showing up throughout the city. And yet, when we had the vaccines and other treatment options were coming, the vaccines in particular, you would think you'd send a fire truck to where the fire was. They were the first communities that got access to were the communities where the incidence of were very low. In the more well-to-do and so forth in communities. And the communities that needed the most, where the fire was raging, weren't receiving. That was a decision. Those were intentional decisions being made in places that, let's say our voices weren't known, or there wasn't someone speaking about equity and someone, even common sense. You don't even need to, you send the fire truck to where the fire is raging, not to the little smoldering campfire and so forth. And so that's what happens. And then the outcomes from that, well, you get increased chronic disease, or you get increased death as it relates to COVID in our communities, because those kind of decisions are being made. So the political piece is significant, and getting our folks where these decisions are being made to raise the alarm or raise the flag and say, no, these resources need to go where they're needed the most.
Yeah. I remember a situation where we were together at Queen's Park, where we saw some kind of the lobbying, the amplifying of the voices in a certain area. I remember having been there and reflecting and saying, this is what we need to learn to do, right? I mean, you mentioned about deputation at the city, for example. I think it's an area where we can pay attention to and be more proactive rather than waiting for somebody from public health to let us know what's happening. I think if we know what other things are being discussed, then we can proactively be there, right? So I think maybe even for us here at TAIBU to start thinking about those kind of things, I think is very important that we go to places where we have to raise and bring the voices of our communities and the challenges for people to hear, because if they don't hear and the system already is not really looking for those support, it is upon us, sadly, and that's what anti-Black racism does, is we are responsible always to bring about change or suggestion to change to anti-Black racism. So I think that was a very good reflection. And I just thought of Dr. Hazel Stewart, who was another great leader and community elder in the community, who made sure that she would send me an email and say, this agenda is going to be on this date. You need to do something about this, right? So we have people internally that can do that, but it should also be part of what we do to be able to kind of get ahead and, talking about policies and changes around policies. And even in the election, participating in the election, both voting, but also bringing representation there as well is going to be very important. The other piece that you also mentioned earlier on is about allies. And, maybe that's also another area for us to consider as Black organizations, as TAIBU, or Black communities. Sometimes I think, in my opinion, because of how anti-Black racism is treating us, or the system is treating us, we don't fully engage with mainstream institutions or allies within the mainstream institutions. We kind of think that they are the enemy. But you said earlier on that in our work we should be able to engage with allies who are in the mainstream, who are in a position of making decisions. Is that something that we need to do? We're not doing well? What do you think?
I think it's something that has to be a part of the strategy. The reality is the burden cannot solely rest on the Black community in terms of solving these problems. And if one thing that COVID should have made aware, one of the lessons that we should all aware, that there's an interconnected between us, right? So something that may happen in the northern province of China will directly or indirectly at some point in time affect people in Malvern, in Rexdale, in Regent Park, in Rosedale, and so forth. So we are connected. You know, nothing is foreign anymore. So the allyship is going to be critical. It's going to be important to do. I'll give you an example on a very basic level for someone as an individual. How can I be an ally, for example? So this happened 2 weeks ago with one of my patients. She's a small business, just started her own small business. A woman, she's in the Brantford area, which is, I think, just kind of heading towards Hamilton, a little bit further from there. And it's not the very most diverse community and so forth. And so she's a part of the BII, the Business Improvement Association in that area. She's the only Black face, she told me, on that committee, trying to make sure that decisions around what's going to do to help the businesses collectively put our own ideas out there, as well as that sort of be incorporated into it. Anyways, at one of those sessions, there was a woman came to her and said, you know what, there is a women's summit, business summit, that was going to be taking place a couple of weeks later, and I think you should go. And so she took it upon herself, said, it was great to go. So a couple of weeks later, she goes to the women's business summit. She said there was about 300 women all promoting their businesses and small business. She was the only Black face there and Black business there. And she brought her products and her services to this event. And it was one of a kind, like she wasn't duplicating any of the other services that are being provided among there. She said there was a lot of interest. A lot of people came to her booth, were asking her questions, looking at her products and her services, a lot of engagement and so forth. But at the end of the day, the vendor to the left and the vendor to the right, they sold out. And nobody, she, in her words, you know, they didn't spend a dime on any of her products and services and so forth. So the allyship, so the lady at the BIA who knew of another opportunity opened the door, extended that invitation, allowed her to get into a space that potentially could have, you know, benefits for her economically and for her business, and to continue to network. That was a simple form of allyship that folks can do, whether you're in the, or, you know, whether you're from the community or not from the community. So you may be able to open doors or extend an invitation for a small business or an organization or an individual, or set up a meeting with an MPP or a council, or with an organization that you feel might be willing to support the organization. One of the two things, though, as an organization, as a Black community, we have to realize that in many cases that allyship may go far, but only so far, in terms of the commitment that might be there. History has already told us that at the end of the day, it'll be our blood that will be shed to gain the rewards and the goal that we're seeking and so forth. But it's critical because it does help to open the doors, help them straight. So in 2020, with George Floyd, right, a global tragedy, but part of the outflow of that, organizations who otherwise previously didn't have any or minimal engagement with Black organizations and Black community, were now thinking, how can we support Black organizations or Black communities and so forth? And many organizations, including at the Black Health Alliance, we saw a lot of interest, new interest from different organizations that previously didn't show any awareness about us.
Corporations too.
Exactly. Corporations. And these are private bodies, big organizations. It could be, you know, with lots of dollars behind them, right? And so building those relationships and leveraging the services, whether that be marketing services, accounting services, it could be technical support, whatever it is that those organizations may offer. It gave you, now it's an opportunity to talk to them about equity, talk to them about some of the projects and initiatives that we're concerned with and how they can build it from a governance perspective, or just resources wise and so forth, and having that opening door, and allowed them to sort of maybe hear about our issues and concerns. So the allyships are important because you can strategically leverage some of that newfound support, some of those newfound resources to move the agenda forward. And those, it's often about not who you know, but or about, sometimes it's not about what you know, but who you know. And those organizations, those board members know other board members that sit on other tables and other organizations and can bring that. And if people begin to understand that your capacity to thrive is directly related to my capacity to thrive, and then we talk about Afrocentricity and the Ubuntu, and I am who I am because of who you are. And as we begin to sort of embrace that, we're recognizing that, there's enough for everybody and that your well-being is connected to my well-being.
So 2020, you mentioned about the global tragedy of George Floyd and many other tragedies that has taken place, including here in Toronto, Regis Korchinski Paquette. And then that was also within the environment of this international pandemic that disproportionately impacted Black communities. And, there has been several opportunities that came out of that. And sadly, I think in my experience, is many opportunities come at the back of tragedies. We've seen George Floyd. I know, Danzig, the shooting that happened in Danzig, and then the Black Youth Action Plan, the Summer of Guns, and then the Black Youth Challenge. Addressing anti-Black racism around community safety, education, crisis support, all those kind of things take place after something happens. It's always reactionary. And sometimes also follows the cycle of government election processes, right? So, we talked about how the issues faced by Black communities is very systemic, it's generational, and requires a sustained effort, multi-pronged effort in different areas: programming, services, access, policy, research, data. So when I look at all of this, and this is something that the Black Health Alliance has been, working on and talking about this, do we need a Black health strategy?
I saw where you're going. I knew that question was coming. Right. But absolutely, absolutely. And when we talk about, as Denise would put it, the policies, right? Having a strategy that's in place, that's been adopted, allows, regardless of, which government's in office, and the changing tides and so forth, it gives us a roadmap to follow generationally wise. And the strategy, as opposed to being reactionary, which, yes, everything we do, sadly, is reactionary. We need to be thinking upstream, proactive, right? So, we have a housing crisis right now, and all the talk, most of the people you talk about, we need more shelters, we need more homes. I'm saying, okay, that's not the answer, right? The problem is, how do people find themselves in that situation? Right? Yeah. And let's talk about that, and let's talk about the factors that get them there. The opioid crisis, again, same thing. So as you talk about crisis, and then we have an initiative or some funds or a new account will come up to place, even with TAIBU, because it was, as you mentioned, the summer of the gun. Yes. Right. There was a whole lot of shootings that were taking place in the community at the time. United Way had just done a project looking at the services, and they came up with the, I think it was a
poverty by postal code.
Yeah, poverty by postal code, and they're looking at which communities were underserved. They weren't walkable. They didn't have health services. They didn't have social services. They didn't have this. They didn't have that. So that research was there, and that advocated for some of the communities that we're talking about. And then we had all the violence that was taking place in the summer of the gun. And timing, while we were putting forward the proposal for the community, for TAIBU, that came at the same time that those pressures were existing in front of mind and making the news lines and so forth. So it in many ways, it sort of bolstered our argument, saying that the need is great and we have the evidence to show it and so forth. But yes, absolutely, we need to be more proactive instead of just responding to something after a crisis, right? So that's why a strategy, a Black health strategy, health and well-being strategy at the provincial level, nationally and so forth, is so critical, because the strategy will address the early interventions, building communities, building families, what supports are needed early on as it relates to education, housing, all the social determinants of health, which of course includes racism and anti-Black racism, and specifically. So it's something that the Black Health Alliance has been pushing, and other organizations, I know TAIBU has been a part of it. And well, again, George Floyd and a lot of those efforts, even the Black mental health strategy at the city and the Black mental health day that was developed again. So these are the ways in which our organizations have to push to advocate for the kind of change and push for long-term sustainable change through strategies, through policies that can exist on an ongoing basis. And so as you talk about engaging politically, it's not just at election time, it's got to be year round. It's about building those relationships. So, and moving collectively as a crowd, because numbers matter, so that they can show that this is a real issue. There's an organization, there's a body, they represent a community, and these things are important to them. We need to address it, and so forth. So,
as you're sharing your thoughts and reflections, I'm reflecting on what the city has done. I think the city, with its the action plan to confront anti-Black racism, that is kind of a strategy, because now we've had the 5 years of the plan, and now there is the 10 years extension of the plan, and that has helped to focus on certain areas. Obviously, the pandemic has brought in some additional challenges, but something like that, I think, provincially also, the Ontario Health has developed the Black Health Plan, which is now, because with every strategy and big picture, there is an attached resource that needs to come. And I think those small steps, are, but we also need to make sure that they are aligned, because the city is doing something and then the province is going to be doing something. We're expecting for the federal government to do a similar kind of a plan, but they're all aligned, because, what the federal jurisdictions need to align with what the provincial jurisdiction is. Health, for example, in the province, and maybe, criminal justice with the federal system, and then with the city around housing. So all those, I think, need to be aligned to make sure that there is work in every aspect, because they're all connected, right? As you said, a housing issue is not just a housing issue. It's connected to other things that happen. Or a health issue is not just a health issue. It's connected to housing, education, employment. So that kind of a bigger picture strategy that aligns everything in place seems to be something that hopefully will bring all those focuses together, and then have some resources that is sustainable, and making sure that happens. And then research and data. I think you touched upon it, but we've made some strides around race-based data collection. But how about research? Because I think the two are a little bit distinct. In your when you were doing and establishing BHA and doing stuff, how much of research are there to to help us demonstrate need or demonstrate something that is working. What is that an area that we should also be focusing on?
I think it's important. I know in those early years with BHA, we had a lot of anecdotal stuff.
Yeah.
Right? So we knew what was happening with those respective organizations, whether it be sickle cell or HIV and AIDS or diabetes and so forth. We knew what was happening in the community. There was little pockets of community-based research that was being done. So, for example, I remember the one on kidney disease and end-stage kidney disease among the Black community, right? And usually these were initiatives that members of the Black community, health professionals who were interested in that, took it upon themselves to begin, because they saw what was happening in their hospitals or in their clinics or in their offices or whatever the case may be, and wanted to begin to document it. As I mentioned, Health Canada as a practice wasn't looking at health and health outcomes in that way. So the community members had to begin to raise the issue around it. But there's the tracking of data, which is one piece. And often that can help to show where the disparities are, the incidents here and so forth. But yes, looking at research as well and putting forward projects and so forth. It could start off, you can build. So we look at breast cancer in women and breast cancer screening. Yeah. So, with the Ontario Black Physicians Association, they took it upon them in partnership with the Olive Branch of Hope, looking at breast cancer in the Black community among Black women specifically. Yeah. What we know is that sometimes it will occur earlier at a younger age and it'll be more aggressive. Yeah. So screening becomes that much more important. Right. And so trying to create an opportunity here at TAIBU, I know is a big part of that, working in partnership to start a screening initiative to see if we can increase screening among Black women. Because if we can save those lives and those families and that's significant. Yeah. That's huge. Yeah. Right. And begin to do that data. And now it's better now than it was then in terms of maybe taking that project and getting that published and shared, and knowledge translation and knowledge sharing that could then be used and extrapolated so that other organizations or other communities that are serving Black people, because one of the challenges is that BHA or TAIBU, geographically, we may operate in a certain area. Yeah. But of course, there's a diversity within the Black community, and we're all across Ontario and all across Canada. And, BHA and TAIBU can't be everywhere at all times. Yeah. So developing those models, doing some of that research and sharing that so that they can be then transported and extrapolated throughout Ontario and throughout Canada, wherever we are, can then help build that knowledge base and most importantly, help the Black community. So data and research is going to be one of the foundations of getting our community to thrive in one of those strategies. Absolutely.
So, two questions just to wrap up. The first one, the Black Health Alliance came out of what you observed and said, okay, people are working in silos. We need to come together and get some more strength and a more kind of strategic approach to what we're doing. And then out of that, the idea of having, okay, we need a space. We need a space that will focus on the Black community and will embed some of the Afrocentric values and principles to be able to provide a service. Is there another vision? Is there another idea? Is there another kind of initiatives that you are envisioning right now? What is the next thing that Dr. Morgan is thinking?
That's a good question. What I think, for me, what I'd like to see, and we're moving in that direction, is scale and impact.
Right.
I think what we've been doing is fantastic. As I was just kind of continuing on our last comments, is scaling that impact, scaling the services, scaling the reach of what we're doing. I know you've been to conferences in the U.S. and shared what TAIBU has been doing. and many of the other organizations didn't know about it and was impressed about the work that's being done here and so forth. So, because we know that, and there are partners and there are organizations, in Halifax and Alberta and other places where Black communities are that are doing good work as well too.
Yeah.
And so in the same thing where, what we did with BHA locally, Toronto, looking at different organizations, pulling them together to work to a broader good, that now has to be done on a more interprovincial level. So organizations that you're reaching out to, they could be in Montreal and Quebec. I know we had people saying, can we have a chapter for the Black Health Alliance in Quebec or so forth, and our Francophone communities and so forth. So it's really strategically reaching out above our original geographic borders, making those connections with organizations across the province, across Canada, so that we can have a national presence impacting all levels of governance, federally, provincially, and locally. Because as you correctly pointed out, when you're looking at having our Black community thrive and our communities and our families thrive, all these housing, employment, education, climate change, healthcare, there are different levers and different levels of government have different inputs into those systems and so forth, and there needs to be some coordination of that and trying to minimize any loopholes and gaps in that and so forth. So the broader vision is to take what we've done, scale it, improving the impact and so forth and so.
Thank you very much. So my last question is, and TAIBU is a name that was that came out of Black Health Alliance. What does be in good health mean to you?
The word that comes to mind to me is really thrive.
Thrive.
Right. And well-being, being able to thrive. We want the next generation. I've 4 children, my wife and I, and some are two are in high school and 2 are now in university and so forth. And there's a lot of anxiety among young people about the future, and for good reason. Yeah. I mean, whether it be the changes that are happening in the climate, whether or not their own economic viability, can I even have a home to live in and so forth. So there's a lot of pressures, and really what we want to do, for me, is being able to thrive, is to have the opportunities to contribute to society, to have some joy, to have choices and options in terms of what I want to do and how I want to contribute, and to have as few as possible barriers to that opposition, and in doing that and developing sort of a mindset culturally within our community about as I've always said, if we cross the river together, the alligators won't bother us. Yes. The mantra of the Black Health Alliance was working in partnership to advance the health and well-being of the Black community. That collectiveness, not easy to do, because we are diverse and we have different interests and backgrounds and experiences and so forth. Yeah. But there are some common goals that we all want to see all of us thrive and do well. And so for me, that's the word that comes to mind. Spiritually, physically, emotionally, mentally, thriving.
Thank you very much. It's been a great honor as always, and thank you for your insight, for your perspective, for your views, for your vision. We do really appreciate, where we are today because of some of the things that you started, initiated, and got people to come together. I think the coming together is an important aspect, and then thriving. So we really, really do appreciate. Thank you for your time and your perspective, as always. I'm now concluding this episode around anti-Black racism. Our conversation was with Dr. Christopher Morgan, the founder of the Black Health Alliance and founding member of the TAIBU Community Health Center. I hope you've enjoyed the conversation. You've learned a few things about Dr. Morgan, about Denise Brooks, but most importantly, about the work that has taken place and the work that is ahead to improve the health and well-being of Black communities and getting all of us to thrive in what we do. Thank you.